This is Dr. Julie Elner. You're watching the post-op educational lecture for the gastric bypass. Let's get started. Since you've just had surgery, your jobs are listed here on this slide. You need to be doing your deep breathing, 10 deep breaths per hour on your incentive spirometer that you got in the hospital. You need to continue to walk at least every 2 hours. Do get out of the house at least once a day. You'll want to take an excursion out to a park or out to the beach or even out to the mall to really get out and about, get your legs stretched at least once a day, and you can take little walks up and down the block for the rest of the day intermittently. Do continue to drink 64 ounces of fluid per day. Everything counts toward your 64 ounces: water, broth, jello, protein drinks, sugar-free popsicles. Don't forget to take your antacid medication. You'll be taking that twice a day. Today we'll talk about eating and meal preparation. We'll also talk about nutrition, exercise, and what's on everybody's mind, which is diet advancement. Let's talk for just a couple of minutes about how to eat after surgery. These rules will always be in place for you. Remember that your stomach is only about the size of a golf ball, and the outlet that connects the stomach into the small intestine is only about the size of an M&M. So to get food to slide quietly and safely and uneventfully through that little outlet, you need to be sure and chew your food. Chew it to the point of baby food consistency. Always eat protein first. That goes for the rest of your life. Never put anything in your mouth until you've put protein in first. Moisture is always going to be important. Dry foods are more likely to stick and clog up your little outlet. Texture of foods is important, and in the beginning, during the healing stages after surgery, you'll notice that the foods that are on your list to eat are non-fibrous and non-stringy foods. Sit down to eat with no distractions. One of the most common reasons why people get sick and vomit is because they swallow too soon or don't chew well enough, and that's because they're in the middle of a conversation with someone, or they're watching television or paying attention to the family or the children, and they're not paying attention to how they're eating. So sit down, potentially even on your own, with no distractions, so you can pay attention to how you're chewing and how the food feels in your stomach. Don't ever drink within 30 minutes before or after a meal. And when you are eating, limit yourself to no more than 20 minutes to eat. For the first month, you're going to eat only once per day. Do not eat twice a day, and eat only a medicine cup full of food. Do not eat more than a medicine cup full of food, and that's about 2 tablespoons in total. You're going to be taking little tiny baby spoon size bites at a time, but don't eat more than a medicine cup full of food and no more than once a day. As you advance into the more dense foods in weeks 3 and 4, you might find that you fill up on even 1 tablespoon of food or even less. If that happens and you feel full with less than a medicine cup, stop at that point and do not eat more later in the day. Let that be the amount that your stomach has to work on for the rest of the day. After the first month, you will not be eating just once a day no matter what. You'll want to eat only when you're feeling low blood sugar. We'll talk about that in the office, but it's important that you determine what your first symptom of low blood sugar is, so you'll know when your body is actually truly hungry. And you will be staying on a medicine cup full of food for the first couple of months. It's important to understand what will irritate or potentially damage your new stomach pouch. As we mentioned a minute ago, overly dry foods will be more likely to stick. Foods that expand and soak up water are more likely to clog up your outlet. These are listed here: rice, pasta, bread, those sorts of things that will soak up water will expand inside your stomach and be very uncomfortable and potentially cause vomiting. Fibrous and stringy foods like celery and oranges are more likely to cause a little plug inside your stomach in the early stages after surgery. But the most common reasons why people have irritation of their stomach are eating too much, eating too quickly, and not chewing enough. You always have to pay attention to those three things. It is very, very important for your safety to never, never eat anything before it says in your manual that it is safe to do so, not even a single bite. Taking a single bite of a food before it is safe to do so can cause severe and potentially fatal complications, even one bite. So never eat anything before it says in your manual that it is safe to do so. So let's talk about an outline of how things are going to progress over the next month for you. Week 1, you're drinking protein drinks, fluids only, water broth, jello, but you're getting your nutrition in the protein drinks. Week number 2, you're starting to eat a medicine cup full amount of soft, soupy, mushy foods in addition to your protein drinks. Weeks 3 and 4, you're adding moist protein like very soft meats and fishes, a medicine cup full per day in addition to your protein drinks. So let's jump ahead to week 2, which is the second week. Week number 2 is days 7 through 14 after the surgery. What's listed here are the types of foods that you can eat during that week, but remember, only eat a medicine cup size amount and make sure that they're nice and soft and soupy, and be sure that you do chew them up. Even though they're very mushy, you have to chew them up in order to get them to slide through your little outlet at the bottom of your stomach. It's important to continue to drink 64 ounces of fluids per day in addition to your little medicine cup full amount of food. Weeks 3 and 4, you can start thinly sliced deli turkey, low-fat string cheese, soft fish like maybe a sole or a tilapia, no dry, hard edges, don't overcook it. Canned chicken and tuna go quite well, and amazingly, boiled shrimp and a pan-seared scallop will also go well. But remember that you need to only be eating a medicine cup full amount of this and no more. Imitation lobster or crab is fine, or real crab. Soft tofu is just fine. But remember that these foods are denser than what you have been eating so far. So you might fill up on a couple of little baby spoons full of these foods. And if you feel the sensation of being full, you need to stop immediately, because that means that your little outlet is plugged. As you progress through the weeks and months, feel free to jazz up your foods and add salsa, spices, balsamic vinegars, any sorts of herbs and seasonings are fine. What you don't want to add is extra sugar or extra fat. So if you're needing to mix up canned chicken or canned tuna with something moist to make it into a soft little paste, then consider low fat or light mayonnaise, plain yogurt, or chicken broth if you're needing to add a little bit of moisture to something like refried beans. You can also add ricotta cheese or mustard. When it's time to prepare your meats down the line, remember to bake, broil, grill, or use a crock pot. You don't want to overcook or over dry foods, and you very certainly don't want to fry foods, which will add extra fat, but also can cause very uncomfortable and potentially dangerous dumping syndrome. So do not fry your foods. Let's talk for just a minute about what dumping syndrome is. It's due to high fat or high sugar foods coming into an empty stomach. That's the bottom line. If you eat something high fat or high sugar and it hits an empty stomach, you could get the symptoms that are listed there: sweating, heart racing, extreme fatigue, nausea, abdominal cramps, diarrhea. It's extremely unpleasant, and some patients even have an uncontrollable urge to fall asleep. So you certainly don't want this to happen when you're driving home from a restaurant, because if you can't stay awake at the wheel, you're very likely going to end up in a car accident. So that's how this can be a dangerous situation. It occurs most often on an empty stomach, as we talked about, and that's really where the snacking comes into play. It's the nibbling on candies and cookies and sweets and sometimes even chips between meals. So if you eat protein first and then you have a little bite of dessert, more than likely you're going to be fine. That's one of the reasons why you have to eat protein first every single time you eat. You never want to put anything into an empty stomach other than protein. And pay attention to hidden sugars that are in fruit and milk and juice, sauces and alcohol. All those things are basically sugars that will potentially cause dumping syndrome. So month number 2, this is after the first 4 weeks. So this is the 5th week moving forward. You can add cooked vegetables. You do want to overcook them, so prepare them in a way that you would prepare them for a little toddler. That's an easy way to think about it. Eat non-stringy foods with no peels, so start with the ones listed there. You can also add soft fruits, but again, you don't want anything stringy. You don't want to eat a grapefruit or an orange, for instance. You'll want to start with something that doesn't have a peel and doesn't have little membranes inside of it. So kiwis, bananas, strawberries are fine, but remember that you always have to eat protein first, and protein should be 75% of your meal, and the other things should be 25% of your meal. Month 2 continues with chili and ground beef or ground turkey. Rotisserie style or grilled soft chicken can be added. Dark meat, of course, is more moist. Soups with overcooked vegetables and well-cooked soft meats are fine. But remember, you should only be eating a medicine cup full amount of this food once per day or so. But during the 2nd month, you're really going to be waiting for your low blood sugar to tell you when to eat. And typically that's going to be once a day, but not always once a day. So after the 1st month, you're going to wait for your low blood sugar to tell you when to eat, but don't eat more than a medicine cup full at a time of these sorts of foods. Once you get to the 90-day mark, you can add other cooked vegetables, like the things that are a little bit denser and have stringiness to them. You can also add raw vegetables like salads. So at the 90-day mark, you can start eating salads. You can use low-fat dressing, and you can also add sashimi into your diet if you like sashimi. Not much changes between the end of the 3rd month and the 6th month. But at the 6th month mark, you get to add the last food that is kind of the most difficult food to tolerate, which is steak. So we're looking now at steaks, pork chops, fillets, those sorts of things. If you want to go ahead and try those, you can. But do remember that you're not going to be able to eat very much of it, and these are very dense, so you have to chew them very well to make sure that they can leave your stomach properly. As I mentioned before, never ever advance to the next level until you're doing well with the foods at the current level. Everyone heals at different paces, and it's important to understand what your stomach is telling you. If your stomach wants you to move along slower, then we need to listen to it, and you need to move along slower, but never, ever, ever move along faster than what is outlined in your manual. So let's go through the weapons for success. We're going to talk about each one of these individually, but on a daily basis, I want you to mentally run through your weapons for success to remind yourself what you're supposed to be doing every single day for the rest of your life. The W stands for water, 64 ounces through the day. E is exercise. P is always eat protein first. N is no snacking. S is supplement with your vitamins. And the second S is support group. So why is water important? Well, first and foremost, it enhances your weight loss. It also decreases appetite, it flushes out ketones, and it's the ketones that give you bad breath when you're losing weight. So it's always nice to stay hydrated so you can minimize the bad breath you get as you're losing weight the first couple of months. Drinking a lot of water also helps prevent kidney stones. It increases energy and decreases that fatigue that you feel after surgery. So staying good and hydrated will definitely help you bounce back faster and feel better faster. And it also increases your skin elasticity and helps minimize extra skin. People who are dehydrated are more likely to have extra skin after the weight loss. So stay very well hydrated. Count the ounces of water that you drink each day and make sure that you get 64. If you have plain water on a given day and you're finding that it makes you a little bit nauseated or a little queasy or it just doesn't taste good, that's very normal. You can mix in very dilute products to kind of flavor up your water a little bit if you want to. Herbal tea is fine, Propel, Crystal Light, non-calorie flavored waters, but just keep them very dilute. Don't make them full strength. Do not drink coffee or non-herbal tea. Do not drink soda and don't juice anything. Don't juice fruit and don't juice vegetables. It's potentially dangerous to do that, and they have appetite stimulants. So don't ever juice fruits or vegetables. It is important to dilute the flavors that you're putting into your water because anything that is very sweet and flavorful between meals does stimulate the brain to crave sweets. So you want to keep these things very dilute. The E in weapons, of course, is for exercise. It's important to exercise to enhance your weight loss, but it also helps prevent weight regain. Lack of exercise during the weight loss phase is the leading cause of weight regain during the 3rd and 4th year. You absolutely must exercise. Exercise also protects your muscle mass. We want to make your body lose fat and not lose muscle. We don't want you to get skinny and weak, so it's important to protect your muscle mass by doing the right kind of exercise, and we'll talk about what that is. Exercise also reduces cravings and reduces your appetite. It increases energy and decreases fatigue. Exercise also improves your mood, and it definitely helps that skin shrink up. It also helps increase circulation, so you are less likely to get a blood clot. So let's talk about how to do exercise. There are 2 types of exercise: cardio, which is anything that gets your heart rate up, and resistance training, which is weight training. Cardio training alone allows muscle loss to happen, and that causes weight regain. So you can't rely just on cardio exercises like jogging or walking or being on the stair climber or being on a bicycle. That's just cardio. You can't rely on doing cardio alone and expect to keep your weight off. You have to add weights to your workout regime because that enhances your weight loss, but it also helps keep the weight off by preserving your muscle mass. Adding weights to your workout regime also makes your body burn calories for hours after you stop exercising. rather than just doing cardio, which is going to lead to some calories being burned while you're exercising. But if you add weights and weightlifting to your exercise regimen, you continue to burn calories for hours after you've stopped exercising. So let's talk about the details of how to do it. The first month, you have to limit what you're doing with your abdominal muscles, your stomach muscles. If you have to use your stomach muscles to pick something up, if you're bending your waist to pick something up, that's where you're limited to 10 pounds. But you can lift unlimited weights on your arms and your legs as long as you don't involve your stomach muscles in it. So you should get to the gym absolutely as soon as you can after the surgery and start doing light weightlifting with your arms and your legs, but basically leave your stomach muscles out of it. That's the easy way to think about it. You want to add 30 minutes per day of cardio at your goal heart rate and add that to your weightlifting. We'll talk about what your goal heart rate is, but anything that gets you to your goal heart rate counts toward your cardio. But be sure and ask me in your appointment what your personal goal heart rate is. So you need to get to your goal heart rate 6 days a week, and your ultimate goal is 30 to 45 minutes per day. And as I just said, anything that gets you to your goal heart rate counts toward your cardio. The clock starts ticking for that 30 to 45 minutes when you reach your goal heart rate. If you're finding that you're enjoying walking around your neighborhood as exercise, but you don't get to your goal heart rate, try adding hand weights to your walk. Pump those up and down as you're walking, because that will increase your heart rate without you having to break into a jog or a run just to push your heart rate up. Let's talk for a minute about strength training, which is weightlifting. This needs to happen 5 days per week, and you need to do weightlifting on every muscle group in your body for at least half of your body each day. So a lot of patients will do every muscle group in their upper body on one day and every muscle group in their lower body on the next day, and alternate back and forth. That way you're giving half of your body a rest on any given day. You just have to be sure that you're hitting all the muscle groups in your body. You don't want to be exercising just your arms and your legs and leaving your back and your abdomen and your hips out of it. When you're wondering how much weight to put on a machine and how much to do, you want to do 2 to 3 sets of 15 reps, which is 15 lifts for each muscle. When you're wondering how much weight to put on the machine, you should be able to do 15 lifts or 15 reps, but working very hard for the last 5. But you should be able to get to 15. You should have enough weight on the machine that you can just get to that 15th lift, but not go much further. So if you can easily get to 15, you don't have enough weight on that machine. If you can't get beyond 10 or 11, then you have too much weight on the machine. So use that rule of 15 as your guideline, and you want to do 3 sets of 15 as your ultimate goal. Once you get to the 1 month after surgery mark, there are no lifting limitations. Unless you had your surgery through a big open incision, then you have to wait 6 weeks rather than 4 weeks. But otherwise, for the folks who had laparoscopic surgery, and that is the vast majority of you, you can do unlimited weightlifting with your stomach muscles 1 month out of your surgery. Be sure that you vary your workout. It is important to not do the same thing every single time you go out to exercise. So once or twice a week, throw in some yoga, strengthening yoga that is, or Pilates. Do some outdoor activities like hiking or a boot camp and add that to your weightlifting regimen in your gym. Water aerobics are fine for those of you who really have difficulty getting around and are seriously disabled and not able to do other sorts of exercise. But otherwise, water aerobics for people who are otherwise able to walk and are healthy, it just doesn't hit the mark for you. It just isn't enough exercise for most people. Patients do best in the long term when they get a trainer in the beginning. Even if you get a trainer for 4 or 6 months, that will be the best decision you ever make second to the surgery itself. People who get trainers generally do far better in the long run than people who don't. So let's talk about the P, that's the protein. We need to be sure that you get enough protein as nutrition. As you're slowly increasing the amount of solid food that you eat, you're counting the protein grams in your protein drinks. Women need about 60 grams of protein per day. Men need up to 80 grams of protein per day, but do not exceed these values unless you talk to me first. It's important to get enough protein because it feeds the muscle and it enhances the weight loss. It also staves off the appetite, so it decreases cravings and it increases the full feeling. It also decreases fatigue. So it's important to count the protein grams in your protein drinks, but you do not need to count protein grams in your food as long as you're eating the right food when you do eat. So protein is the most important of all your foods. That's why you have to get it in first, and getting protein in first decreases your risk of having dumping syndrome. If you eat something a little bit sweet, like a strawberry or a little piece of banana after your meal. The protein in the nutrition also speeds wound healing, and it's really the only food that your body absolutely requires after gastric bypass, because we want to encourage the body to chew up the fat to get the other nutrition that it needs, but it does not get protein by chewing up the fat. That's why it's important to feed it protein from the outside. As we talked about, women need 60 grams of protein per day, men need 80. Use your protein drinks to obtain the values that you need, but then you're adding more food over time, and we will decrease the protein drinks over time based on how you're doing with the eating, but also based on your lab testing that we will do. So when you're drinking protein drinks, you continue to follow the same guidelines that you were following on the pre-operative diet, which is less than 4 grams of sugar and less than 4 carbs for every 20 grams of protein. And the same rules apply after surgery in terms of mixing up your protein drinks. Mix only with water, never mix with anything else. Never put milk of any kind in a protein drink, or juice of any kind, or fruit of any kind in a protein drink. The N is no snacking. Never ever eat anything unless your body is truly hungry, which means that you're starting to feel a low blood sugar feeling. Your brain telling you that it's time to eat because it's noon is not a hunger signal. Your stomach making noises and grumbling is not a hunger signal. That's not a signal that your body is actually low on fuel. The only signal that tells you that your body is actually low on fuel and you need to eat is a low blood sugar feeling. And you'll learn over time to recognize that very early on when you're just getting a twinge of low blood sugar before you get to the point where you're really uncomfortable with it. So you'll learn to recognize it when you start to feel a little bit headachy or a little lightheaded, or even a little bit of inner anxiety or a little agitation. Sometimes people call that being hangry. You'll learn to recognize that very early on. That is your hunger signal. But never snack. Snacking is force feeding the body when it's not truly feeling hungry. That's dangerous after surgery, and it also leads to more snacking, which ultimately leads to weight regain down the line. Snacking chemically induces your body to crave more food and teaches your brain that it's okay to eat when it's not hungry. It's important to understand why we do snack. So let's sit down and be very honest with ourselves. When we're feeling like eating, we need to identify what is triggering that. A lot of us eat for a lot of different reasons. We're only human. We eat for reasons other than hunger all the time, but it's important to understand what your triggers are. It's important to understand what makes you feel like you need to eat when you're not hungry, so you can really identify what's triggering you and change that in order to stop snacking. It's also important to realize that your body doesn't know the difference between hunger and thirst. And when your body is dehydrated, it will frequently send you a hunger signal. So you need to be sure that you're staying hydrated and drinking your water the way you should throughout the day, so you're not fooled into thinking you're hungry when you're really thirsty. As I mentioned, it's important to understand the reason why you might be stress snacking, to identify a path to a more healthier relationship with food. So we need to understand what our triggers are so we can deal with that stress in a way that doesn't involve feeding ourselves and force feeding our bodies. Some patients have had luck with having a big pantry clean out. For a lot of my patients, cleaning out the kitchen of the snack foods and the sweets and the carbs and the chips has really been helpful, not just for them, but for the entire family, because those are foods that a lot of people really shouldn't be eating. And if you go to a party or you're going to some sort of event or a conference, try to position yourself as best you can away from the party buffet so you won't be standing right next to it having a conversation with someone. Try to develop ways of spending time with your friends and your family doing things that aren't food related. So maybe take walks, go shopping, go to museums, movies, have game nights, develop relationships with the people who are close to you by doing things that really doesn't involve going to a restaurant and eating. You'll find that you can be a bigger part of the conversation and have really a more meaningful relationship and have more meaningful time with people when you're not distracted by food, and you can make it about the conversation and you can make the time about the relationship that you have with people when you're not distracted by the food. Exercise is a great way to avoid snacking. I have patients who set their gym time or set their walk time for their time in the day when they're most triggered to snack, and they've found that to be very fulfilling and very successful for them. And as I mentioned, be sure you drink lots of water because dehydration leads to a hunger feeling. The first S is supplementation. We're going to talk about each one of these vitamins individually, but the vitamins that you have to take after surgery are listed here. 2 high-potency multivitamins, B12, calcium has to be in the form of calcium citrate, iron has to be in the form of ferrous fumarate. You need a B complex in the form of an uncoated capsule or an uncoated tablet. And some patients need extra vitamin D depending on lab testing. But always remember to separate your iron and your calcium and separate your B complex from your multivitamin, both by 6 hours. All of these vitamins are available in the office. They're also available online directly from the bariatric websites, but the downside of buying them online is that you do have to pay shipping. They're the same price in the office, you just don't have to pay shipping. So let's talk about the morning vitamins. In the morning, you take 2 multivitamins. They do have to be high potency and they need to be chewable for the first 90 days. After 90 days, you can move on to capsules or regular vitamin pills. Calcium needs to be in the form of calcium citrate, and most people need around 2,000 milligrams per day. We recommend that you get it from a bariatric manufacturer because the over-the-counter calcium is half the dose per piece of the bariatric calcium, so you have to take twice as many, and they're huge tablets. They're very irritating to the stomach when you try to buy calcium over the counter. So do get calcium from one of the bariatric companies, but you have to be sure that it is 100% calcium citrate and not a mixture of other types of calciums. You'll need to take it in the morning in order to separate it from your iron, which you'll take at night. Vitamin B12 is the only vitamin that you don't take every day. It's the little under the tongue one. It dissolves immediately under the tongue. You need 1,000 micrograms 3 times a week to start, and then we'll adjust your dosage depending on your lab testing. It does have to be sublingual, which is under the tongue, or in the form of injections. You cannot use a swallowed form because you can't absorb a swallowed B12. Injections are fine if you like to get injections, but injections don't work any better than the little cheap under the tongue pills. Injections are absolutely absorbed the same way as little under the tongue pills. They are available in the office, and most vitamin stores have them as well. Iron must be in the form of ferrous fumarate. You have to have 100% ferrous fumarate, and this too really should be purchased in a bariatric brand. Don't try to get over-the-counter ferrous fumarate because I've seen patients try those and they really, for whatever reason, just don't seem to absorb well. So you need to be sure that you get a good ferrous fumarate from a bariatric company, and I can definitely make recommendations for that. I have them in the office, but I also can tell you where to get them online if you prefer. Most people need 30 to 60 grams per day. These will be adjusted based on your lab testing. You have to be sure that you separate your iron from all calcium in calcium pills and calcium-rich foods. And it's also important to remember that all protein drinks have calcium in them. So when you take your iron, which should be at bedtime, you need to be sure and finish up your entire day's worth of protein drinks 6 hours before your bedtime iron. If you're eating dairy products that day, if you have something with cheese or something with yogurt, you can have that, but you can't have it within 6 hours of your bedtime iron. Once you start to eat salads, remember that dark green leafy vegetables like kale, broccoli, and spinach are all full of calcium. Do not take your iron with caffeine and take it at bedtime, as we talked about. B complex needs to be uncoated. The capsule is the easiest. Usually people take these at bedtime, but if it keeps you awake at night, you can take it a little bit earlier in the day. It is an energy pill, so occasionally patients will have trouble sleeping if they take it at bedtime, but try it at bedtime because that's how most people do the best with it. If you need to move it earlier in the day, you can. You just need to keep it 6 hours away from your multivitamin in the morning. In order to start your vitamins, after you have your appointment with me about a week after your surgery, you can start taking one new type of vitamin per day over the next several days. Do not start your vitamins until I tell you that it's safe to do so, but when you do start them, start one new type of vitamin per day, which means you have to take your full dose of that vitamin per day. That means 2 multivitamins, not just one. If you're taking the bariatric calcium, you'll have to take several of those. The typical dose is about 4. So when you start your calcium, you have to take all 4. So don't take just one pill as the day goes by. Take your full dose, but add them in one at a time over the next several days. Don't ever forget to take your vitamins And don't ever neglect to get your lab testing done. You absolutely must get your bariatric labs ordered and checked by either me or another bariatric surgeon, not your regular doctor, and we have to check them annually for the rest of your life. Your regular doctor won't know what lab test to order on you after you've had surgery, and they won't understand how you absorb vitamins differently after your surgery. So you can never rely on your primary care doctor to know how to manage your labs and your vitamins long term. Don't ever stop taking any of your vitamins. When you go on vacation or you go out of town even for a day or two, you must take all of your vitamins all of the time. Stopping even just temporarily can cause dangerous or permanent or even fatal deficiencies, sometimes in a very short period of time. So you need to be sure that you take your vitamins all the time and don't run out. Get your refills before you run out. The last S is support group. Patients definitely do better when they attend support group. That's just the long and short of it. People make more rapid adjustments to surgery. They're more likely to keep the weight off. They're definitely more likely to be successful with weight maintenance. It helps people embrace the program as a life change and not look at the surgery as a quick fix. This surgery is just a tool, and it's up to you to learn how to work the tool into your lifestyle and live in a healthy way using your tool the way it's designed to be used. And you'll learn about doing that on a day-to-day basis in support group, as well as your monthly appointments with me in the office. It's important to keep yourself honest, keep yourself accountable, and support group is a good way of doing that. In support group, we do address relationship changes with spouses, friends, coworkers, but it's important not to compare your weight loss to other people in support group. You're there for emotional support, but everybody comes into the surgery with different medical issues and different metabolism, different body types, so the weight loss may be very different. In terms of keeping on track in the long term, you want to keep track of your weight on a daily basis. Get on that scale every day, and even if your weight hasn't changed, use that few minutes that you're standing on the scale to review your weapons. Mentally run through your rules every single day and determine if you're on track or not. Ask yourself how you did yesterday and how you might do better today. Ask if there's any part of your list of weapons where you're kind of starting to slip a little bit. So use that daily time on the scale to just do your mental rundown of how your day is going to look and how you're going to do what you need to do to take good care of yourself today. Making healthy choices for your entire lifestyle becomes kind of an interesting and fun challenge for people. When you're losing weight and you're feeling better and better every single day, it becomes fun to use your body. You realize that you can park further away. You realize that you can take the stairs. You realize that walking and exercising actually feels good when you have a body that can keep up with you and not be in pain. So it's important to try to get exercise where you can. A lot of us are very busy. So it's important to kind of grab a little bit of exercise whenever you can during the day. It's also important to live a healthy lifestyle socially. Limit your alcohol intake. Try to do some yoga, not only for strengthening, but it also helps reduce stress. And get regular health care. Really look after yourself. Focusing on self-care is a big part of long-term success after bariatric surgery. You'll also learn how to be social without relying on food. We touched on that just a few minutes ago. Patients have also reported to me over the years that journaling about their experiences, positive and negative, as you go through this process, gives you something to reflect back on and can really serve as a source of strength in the months and the years to come. And share your successes and your stressors with those who are close to you, those who are on this journey alongside you. I think you can find a lot of patients in support group who have shared with their family members, what they're experiencing, and it makes things a lot easier at social and family functions if you've really included your friends and family members in your process. Keeping on track in the long term relies very strongly on you doing your follow-up in the office. That is absolutely critical. It's your responsibility to make sure that you keep your monthly appointments in the office. They happen every month for the first year. You can come into the office or you can check in by phone if you live too far away. We do it quarterly for the second year and annually thereafter. We get labs every year for the rest of your life. And you'll get labs done during the first year on months 1, 3, 6, 9, and 12. But the best way to make sure that you keep on track with your follow-up appointments is to make your next appointment before you leave the last one. The first year is what we call the honeymoon phase. That's where the weight loss happens the easiest. It's where your appetite is almost nothing. You don't feel hungry, and the weight loss just happens so easily. That doesn't last forever. You have to use the first year to learn how to use the tool of your surgery and change your behaviors. So when your appetite starts to come back and your metabolism starts to slow down, during the second year, you've got your healthy behaviors already locked in place to keep the weight off. You have to be attentive and mindful to what you're doing that first year to really maintain the weight loss during the second and third year and onward from there. So make the most of your time every single day to be very mindful to make sure that you're doing what you need to do in the long term so you don't regain weight. It's very difficult to lose weight after the first year, so you need to work very hard to make sure that you're losing as much weight as you can the first year, so the second year and the third year you're not still trying to lose weight. If you find yourself sabotaging yourself, seek counseling immediately. We have to address those behavioral issues because it doesn't get any easier over time. If you start to sabotage yourself the first year, you're going to continue to sabotage yourself the second year. So you want to make sure that you're setting yourself up for success and really get that addressed by a counselor. It's normal to hit bumps in the road. It's normal to feel fatigue for the first 4 to 6 weeks. You just have to get to the gym as soon as possible, start working out, because that's what really diminishes the fatigue over time. It is normal to feel a little bit nauseated or queasy as a result of strong smells, particularly food or perfumes or motion sickness. That happens for the first couple of months. It's also normal to have certain foods just not go well. It's possible that maybe 50% of the foods at a given level won't go well. So stick with the foods that that really do work. It's normal to not be able to take all the foods that are on your list of things that it's okay to take. So just expect that some will go well and some won't. It's normal also to have occasional vomiting as you relearn how to eat and chew. If you don't chew well and you swallow something before it's chewed up, it's going to come back up on you. If that happens once, then think about it and say, what did I do to cause that? And try to learn a lesson from that and try to think how you're going to do things differently. But if it continues to happen, if it happens more than once or twice and it happens repeatedly, then you need to call the office immediately. Diarrhea and watery bowel movements are normal for the first week or two after the surgery. Then your bowel movements tend to firm up and get more normal, but some people do develop constipation problems. The ways to avoid constipation are stay hydrated and get exercising. But if you're having trouble with constipation in spite of those things, there are guidelines in your manual for treating that. And if that doesn't work, then talk to Dr. Elner. Give me a call right away. I'd be happy to talk you through some other alternatives. It's also normal to have muscle soreness, incisional discomfort as you increase your exercise. That's normal. Try Tylenol and a heating pad. Your muscles are going to be sore, so do expect that. But if you develop sharp pains that don't go away when you rest, then you can certainly call me. It's normal to hit plateaus with your weight loss. We lose weight for a week or two, and then we might stop losing weight for an entire week. It's important to ask yourself if there's anything you're doing to cause that stall. So run through your weapons every single day and ask yourself if you're doing everything you should be doing to keep the weight loss happening. And if you are, then a stall could last a week or so, but if it lasts longer than that, then give me a call and we'll arrange an appointment for you right away. It is also normal to have hair thinning from the 3rd to the 6th month. So for about 90 days, the hair thins, so just expect that. It does come back in women. It does not always come back 100% in men. But we need to make sure that you're maintaining good vitamin levels and good nutrition levels to make sure that your hair comes back as best as it can, but it is a 90-day process before those follicles turn back on. It's also normal to feel a little bit emotional for the first couple of months. Your hormones are changing very quickly after surgery. So a lot of folks say that they're just kind of almost teary if they see a Humane Society commercial, or if they see a baby, or if they see a little puppy. The slightest things can just make you kind of tear up a little bit, and men experience that just like we women do. So they're getting a little taste of what it's like to be a little bit hormonal, and that happens for the first month or two, and then you'll kind of steady out. But that can be a little bit surprising to people for a month or two. This is a list of things to be aware of and call the clinic if this happens. If you get a temperature of 101.5 or higher, if you can't pass gas for 24 hours or more, if you're getting increasing pain instead of decreasing pain, or if you get foul smelling or greenish brown drainage out of any of your incisions, give us a call. Leg pain or swelling, vomiting more than once after eating, or shortness of breath, call us right away. If for any reason you're having trouble getting through, then go immediately to the emergency room. But we're available 24/7. What you want to see your regular doctor for are things that aren't related to your surgery. So you still want to see your regular doctor for regular checkups. Please go in and see your doctor within a month or so after your surgery just to check in, so they have kind of a baseline of where you are after your surgery. Then you see them just like you normally would every year for your physical exam, and if you develop any other medical problems, aches, pains, flus, colds, that kind of thing. Continue to see your gynecologist for yearly exams. Men, continue to see your urologist for prostate exams, that kind of thing. Do not expect your regular doctor to do bariatric lab testing. As we talked about, they don't have the training to interpret lab testing on bariatric patients, nor are they trained to adjust your vitamin dosages and your vitamin types based on your anatomy inside, which has changed. The list of things that are dangerous to your stomach are here. NSAIDs, which are medications like aspirin, ibuprofen, and naproxen. Tylenol is typically safe because Tylenol is not an NSAID, but you should never take aspirin, ibuprofen, or naproxen. Smoking, even exposure to secondhand smoke, is extremely dangerous directly to your new little stomach and it can cause severe, permanent, painful, and potentially fatal damage to your stomach. Alcohol is also extremely irritating and damaging to the stomach. Caffeine and even non-caffeinated sodas and non-caffeinated coffee are also dangerous to the stomach. Those aren't listed on there. So don't assume that it's just caffeine that's bad for you. All sodas, all black, green, and white tea, and all coffees, even decaf, are irritating to the stomach, can cause damage to the stomach, and they all have appetite stimulants in them. So you should really not restart drinking any of those things. Other things that patients ask me about are when can they get pregnant? If you wait about 18 months after surgery, then you should be fine to have a normal pregnancy the way you normally would and get regular care from your obstetrician. Do avoid internet advice. You can get emotional support from people on the internet, and if you prefer to go to an internet site to get emotional support rather than attending a live support group in person, that's fine, but never take vitamin advice or nutritional advice from anyone on the internet because they have had surgery from a different surgeon, and all surgeons do these operations differently. And the way they advance their diet program is based on how their surgeon did their surgery. Your program that you're following is based on the type of surgery the way I do it. That's why your program is the way it is. So it's important to understand that other people are getting other advice from their doctors, which might be fine for them, but is absolutely not safe for you. Other cautions, don't email if you have questions about your body or a symptom or how you feel. You should always call us instead, because you never know if an email might not arrive in time or might not arrive at all. If you have any sort of a physical problem or a question about how you're physically feeling, pick up the phone 24 hours a day and call. Do not email with medical issues. You can email about appointment changes, or if you have financial questions or questions about your insurance or your copay, that's completely fine to email about, but never email us about anything that is medical, about the way you feel, or if there's anything wrong with this or that symptom. You should always call us instead. Each time you have an appointment, bring in your follow-up form, which is available on the website under the gastric bypass button. That's the same questionnaire that you fill out every single time for every appointment. You want to fill that out at home and bring it in already filled out. You'll need to have your vitamins and your medications in front of you when you fill out that form. So fill it out at home and don't waste your appointment time in the office sitting there doing your paperwork and trying to remember the dosages and the types and the brands of all the vitamins that you're taking. Also bring in your weekly exercise logs. You can print these off of the website. They're under the Eating and Exercise button. Bring these in already filled out entirely so we can go through that together and look at what exercise you're doing and compare that to how your body is responding so we can really customize an exercise plan that is doable for you, that actually works for you. In the end, I'm proud to be your partner in your journey. I'm thrilled that you've made this decision to undergo surgery. Welcome to the next chapter of your life. I'm happy to be a part of the next chapter of your life. And remember that I'm always available if you have questions. Congratulations on your decision. I'm very proud of you. I'll see you soon.